Easy to buy and often marketed as a natural pain reliever, but concerns are actually growing around a product, and it's called Kratom. Yes, some communities in South Carolina are actually now seeing it with addiction tied to it. So right now we are talking with Ashley right here from LRADAC, the Lexington-Richland Alcohol and Drug Abuse Council, about what Kratom is. I mean, we want to talk about the risks and pretty much, I mean, Ashley, can you kind of just help? What is Kratom?
Sure. Thank you for asking.
Yeah.
So Kratom is currently being marketed as a lot of a natural opportunity for individuals that are maybe seeking something like that to use. But really, it comes to us from Southeast Asia in leaf form. And when it's taken in small doses, it can have more of a focusing effect. Maybe people report some increased energy and ability to kind of focus in on detail. But what we're really seeing is concerns around large quantity and consumption. When it's consumed in the large quantity and consumption, most likely powder, pill, mixed in a drink is very common modality uses here. We're seeing it mimic very much like an opioid. So heavy on pain relief, a lot of people will report that, but also that binding to the opioid receptor in the brain, producing the same impact and effect as an opioid would, which is unfortunately where some of the confusion and concern comes in around what it's really doing to individuals short-term and long-term.
Yeah, so we did hear over in Berkeley County, South Carolina, they had, a big turnout about what was going on. What are we seeing here with you all?
So similar. What we're seeing is this is trending. Now it's not new. This has been around for quite some time, but kind of as we've seen other things, there's a lot of attention around it, and it's interesting and it's accessible. When things like this are accessible, a lot of times there's a misconfusion that it's safe. This is a safe alternative. I don't want to take an opioid, so I'm going to take something like Kratom to help me have pain relief, maybe experience some high similarities as I would with other substances, but this is safer is the misconception. What we really want to inform our communities about is there's not regulation with the FDA around Kratom. It's not been researched as medicinal, nothing in that capacity or category. And so there's not regulation around it, which concerns us for the heightened risk. When we don't have regulation of products, it can be unsafe. It can have high risk of potency.
Yeah. What is LRADAC's kind of best advice right now and the resources that you all have for this?
Absolutely. So our best advice is just because someone thinks something is safer doesn't necessarily mean it's safe. And it does run the risk of having dependency, of having withdrawal. And we don't want anybody to have to experience that. However, if someone is experiencing that, has questions, concerns, wants to know more, parents want to talk to their kids, please reach out to us. We have locations in Lexington and Richland counties, staff that are ready and equipped and trained to have conversations like this, to provide resources to our communities, to keep everyone healthy, safe, and prepared to have the conversations that they're seeking to know more about.
Yeah, I mean, this is the tough conversations to have because you can get it right at the gas station right now. Wow.
Absolutely.
Ashley, thank you so much for giving us an insight about this legal substance that we can have over there. And of course, the addiction things when it goes into it.
Thank you.
All right, everybody.